Why your symptoms and testosterone labs often don't match. This is one of the most confusing parts of low testosterone. Some men have low testosterone on labs and they feel completely fine. Other men, they feel exhausted, they're gaining belly fat, they're losing their libido, yet when we check their testosterone levels, they're normal. How can both be true? Testosterone deficiency is diagnosed really only when you're having low testosterone levels and you're having those compatible symptoms and they're occurring together, because a low number by itself is not a diagnosis. Testosterone levels in healthy men exist on a wide spectrum. The range is like 200 to 800. In different men, they function normally at different points in that range. So there's no single cutoff where symptoms suddenly turn on. So many men with low testosterone, they feel fine, and many men with symptoms end up having normal testosterone. But here's another important piece people miss. Testosterone is highly responsive to stress signals in the body. Common stressors that can suppress testosterone include weight gain, insulin resistance, poor or fragmented sleep, chronic inflammation or illness, ongoing physical or psychological stress. This is the same reason testosterone often drops during acute illness, severe sleep deprivation, obviously, periods of major stress, obviously. In these situations, the body is prioritizing survival and energy conservation. It's not thinking, hey, let's build muscle, let's reproduce, let's hit our peak performance. It's not thinking that way. So this is also why testosterone replacement therapy alone may disappoint. It is just a band-aid, because if testosterone is low because of these ongoing stressors, if you simply replace testosterone without addressing the underlying problem, it's just a temporary band-aid. So even though you're replacing the hormone, you're still having stress and it's still driving the suppression. So you need to address that. This is how it all comes together, okay? Low testosterone plus no symptoms, no treatment, all right? Symptoms and normal testosterone, look for the other cause, the other stressors, and bring them down. Symptoms plus confirmed low testosterone on repeat morning testing. Now we're talking about like a testosterone deficiency and it's on the table. And treatment may help, especially when combined with fixing sleep, the weight, the metabolic health. Got to put it all together, people. All right. Testosterone levels vary between men, and symptoms don't start at a single cutoff. That's why we only diagnose and treat low testosterone when the symptoms and labs and the clinical context, that whole thing, all line up. All right. So remember, testosterone is part of the picture, but it only, it works best when you address the system that surrounds it. That's where you'll get the best outcome. Dr. Merchant out.